Hi, I'm Yoslin, and we are first years here at UC Merced.
My topic is sleep deprivation,
And my topic is iron deficiency anemia.
and we will discuss how both anemia and sleep deprivation compare and contrast to how they affect the body and the brain.
Iron deficiency anemia and sleep deprivation interconnect through the effects it has on the body. Sleep deprivation is the most common disorder among college students, since for some the transition from high school to college is hard. While sleep deprivation is the most common around college students, iron deficiency anemia is more common around women ranging from the ages 18 to 49. Iron deficiency is a lack of iron in the body that can eventually lead to blood cancer. Sleep deprivation is having inadequate amounts of sleep on a day-to-day basis or occasionally suffering from lack of sleep.
The consequences of iron deficiency anemia in the body are actually similar to the effects sleep deprivation has on the body. Starting off with the brain, anemia can cause a person to feel fatigued and it can cause the person to occasionally faint. Next, onto the eyes. When a person has anemia, the sclera of the eyes turns yellow, and sometimes it is hard to tell since the yellow can be very subtle. The heart is also affected because a person can have heart attacks and chest pains. The muscles get weaker, the skin also starts to have a yellow pigmentation, and the person can have shortness of breath frequently, and the spleen can also enlarge.
In sleep deprivation, the effects it has on the brain is also fatigue. But with sleep deprivation, the brain is the organ that is the most affected. For example, the person can be clumsy, moody, they can have trouble concentrating, the person loses a sense of motivation, and they can also be forgetful. Lack of sleep impairs a person's ability to focus and learn efficiently because sleep is necessary to consolidate a memory so that it can be recalled in the future. The immune system also starts to weaken, and not getting enough sleep can result in developing respiratory and cardiovascular diseases, and it can also lead to type 2 diabetes, which can potentially risk which can be a potential risk since the body will be producing more insulin.
The reason the brain is the organ that is most affected is because sleep gives our brain a break from thinking. When we sleep, the brain starts to function in a way that sorts out all of the information we learned during the day and tries to make connections in order for us to remember the information. In a way, our brain is like a car. If we use it without any brakes, turning it off, for example, it will overheat and eventually die down. If this happens, it can potentially mess up other parts of the car. The same is with our brain. If we don't sleep, our brain will eventually start to stop having its usual functions. In relation to sleep deprivation, being first year students here at UC Merced, we both have already experienced some struggles having to fall asleep. Numerous of times, ever since the start of the semester, there would be days that I would sleep until 5 a.m. the following day and only get about a 3 or 4 hour sleep in between because I would have to wake up early the next day for class. Many times it was due to homework and studying, but other times I found myself just staying up thinking about what I still had left to do or other random thoughts circulating in my brain. Up until now, I still find myself staying up pretty late and struggling to fall asleep at night.
As Angie stated, I myself have also found that sleep has become more difficult as a college student. There are nights in where I sleep 2 to 3 hours a night, trying to finish my homework or either studying, and waking up the next day is a hassle when you don't get your full 8 hours of sleep. Iron deficiency anemia affects the blood the most since the person does not have enough healthy red blood cells, which makes it harder for the body to circulate oxygen. It's like dehydration. If a person doesn't consume the recommended amount of water, their body will eventually start to shut down. Once the count for the hemoglobin gets too low, the person is at risk of developing anemia or lymphoma, which are two types of blood cancer, and they're very hard to cure, which often lead to death. For example, my mother was diagnosed with anemia 4 years ago, and it's been a difficult ride. She first found out that something was wrong with her body when she started feeling fatigued. Every day after work, she would take 3-hour naps, and even if she got her 8 hours of sleep in. Um, and then she started noticing that her sclera, which is the white part in your eyes, started yellowing, and she started to lose weight. When she got her blood results back, she was diagnosed with iron deficiency anemia, and she started changing her diet, started eating foods with more iron in it, and now she takes vitamin D pills and iron supplements, and she has birth control patches.
So iron deficiency anemia and sleep deprivation do intertwine. They both affect almost all the same organs in the body and put a person's life at risk. Even if sleep deprivation does not sound harmful as anemia, they both shouldn't be disregarded by anyone, and especially not by college students, because we often have irregular eating habits and class schedules. Thank you for watching.